Welcome to this video summarizing the mechanisms behind diabetic ketoacidosis, or DKA, a serious complication of both type 1 and type 2 diabetes. We will guide you through the complexities of DKA, what it is, and why it happens. Ketone bodies, including acetoacetate, beta-hydroxybutyrate, and acetone, are alternative energy sources used in response to reduced glucose availability. DKA is characterized by the triad of hyperglycemia, ketosis, and metabolic acidosis. In DKA, ketone synthesis outpaces metabolism, leading to accumulation. In DKA, a lack of insulin can promote ketogenesis. In the absence of insulin, glucose utilization is decreased in adipose tissue, driving lipolysis and the release of both non-esterified fatty acids and glycerol into circulation. Non-esterified fatty acids are converted into ketone bodies via beta oxidation in the liver, whereas glycerol undergoes glycogenolysis, leading to an increase in hepatic glucose. Insufficient insulin levels also trigger an elevation in counter-regulatory hormones, including glucagon, adrenaline or epinephrine, noradrenaline or norepinephrine, cortisol, and growth hormone, resulting in either glycogenolysis in the liver, or when the elevation occurs in muscle cells, proteolysis causes an increase in amino acids, which undergo gluconeogenesis. Both result in an increase in hepatic glucose. Finally, increased levels of ketones and glucose production leads to an increase of ketone bodies and glucose in the bloodstream. By understanding these mechanisms, clinicians can recognize DKA early and respond rapidly to prevent life-threatening complications.